My specialty is otolaryngology, more commonly known as ear, nose, and throat, and we manage diseases of the ears, including hearing loss and balance disorders. We provide and dispense hearing aids. We manage disorders of the nose, including nasal breathing problems, infections, and sinus infections. We manage diseases of the throat, anywhere from tonsils to cancers of the mouth and throat. We manage problems of the thyroid and parathyroid glands, and we take care of adults and children. Well, it was a kind of an interesting story because it's vivid in my mind. When I was 8 years old, my grandmother, who was the mentor to my whole family and really the matriarch of the whole family, announced one day when I was standing with a bunch of adults, and I don't know really who they were anymore, and she put her hand on her shoulder and said, "Barry's going to be a doctor." And that was at 8 years old, and so all of my friends who went through high school and college and wondered what they were going to be and what they were going to do with their lives, I was totally spared that. I knew what I was going to be the whole way, the whole time. It was never a question. It was very, very easy for me. So she did me one big favor, and she was right. Well, I'm an avid pilot, and I've been a pilot for about 28 years, and I'm rated in both airplanes and helicopters. I am an avid motorcycle rider and an amateur race car driver. And I have a great son. He's not a hobby, but he takes up most of my time, and 2 dogs. Well, you know, robots are making their way into our field. I don't know if that's really going to be an advancement or if that's going to be a fad, and that remains to be seen. Certainly, molecular treatment of head and neck cancers is going to be an advancement. We're going to be able to select those patients that need surgery versus those who can be treated in other ways in the future, no doubt about that. And we're going to be able to offer them treatments which are much more focused than we are right now. So I think cancer therapy, cancer treatment head and neck is really going to change in the next 10 to 15 years. I think improvement in hearing aid devices is going to continue to progress in leaps and bounds. It has since the invention of the hearing aid, and I think that will continue right up to implantable hearing aid devices, which I think will become the norm probably the next 15 to 20 years.